Virus is in between non-living and living organism. Till today, no one knows that whether the virus is living or non-living. So it has been classified into a category of intermediate category between non-living and living. Because outside the cell, virus is just like crystals. It is just like a non-living organism, non-living structure which can do nothing. But inside the cell, the virus becomes active and starts multiplying and behaves like a living organism. So virus is very, very small. It is very small, much smaller than a bacteria also, and it can create havoc. You have seen in the recent times that coronavirus has created a pandemic and has killed lot many people. Now, whenever your child gets viral, there are certain set of symptoms which are likely to occur. Child is likely to get fever, it may go high grade also. Child is likely to get flu-like symptoms like running nose, some kind of irritation in the throat, maybe some kind of dry cough, or the child may get diarrhea. These are the usual symptoms which occur in children. There are now different types of specific viruses which are having specific symptoms, like chickenpox is likely to give you a lot of rashes on the body, and these rashes are fluid filled. Dengue is going to give you bone breaking pains. So that is why it is called a bone breaking fever. So when your child is suffering from dengue, is likely to have a lot of pains in the body and is also likely to have petechial rashes over the body. Supposingly your child gets infected by rotavirus, he is going to get explosive watery diarrhea and the child can get dehydrated also. So the number one thing is there are 4 ways in which the virus can enter our body. Number one is by inhalation. Supposingly a child is getting, say, chicken pox or measles or corona. Now if the child coughs, then the virus is transmitted to the other healthy person by the respiratory route. Second is the virus spreads by ingestion. So if a child eats a stale food, child is likely to get the gastrointestinal type of viral infections like rotavirus, norovirus. So these infections can occur which are gastrointestinal infections where the child will get vomiting and diarrhea and may get dehydrated. This is the second way of infection. Third way of infection is by the mosquitoes. Dengue fever, chikungunya fever, they are all virus infections. They spread by the bite of a female mosquito which will spread this viral infection. The fourth way of spreading is by the body fluids. Like if we give an unchecked blood to any patient, hepatitis B, HIV, AIDS, these viruses can be transmitted by blood transfusion or by body fluid. So these are 4 ways in which the viruses are transmitted. Number one very important thing is antibiotics will not work in a viral fever. So there is no point of giving any antibiotic in a viral fever. Most of the viral fevers are self-limiting and they will go over a period of time. But there are certain warning signs. If your child is diagnosed having viral fever, you should see certain warning signs when you should rush to the doctor. Number one, if your child is having increase of respiratory rate, breathing difficulties or chest discomfort or pain in the chest. If your child is getting lethargic, is passing less urine or is having explosive diarrhea, your child can get dehydrated. If your child suddenly gets a lot of rashes on the body, you should consult your doctor what kind of fever it is. If your child is getting blueness of the nails, blueness of the lips, you should rush to the doctor. So these are certain warning signs which must be kept in mind by the parents. But by and large, most of the viral fevers are self-limiting. There is nothing to panic. Within 4 to 5 days of their stay, they go away. Keep in touch with your pediatrician. But at the same time, you must also realize it can be life-threatening also in very few percentage of cases where your child is suffering from dengue, chikungunya or swine flu or coronavirus. So these are the few bullet points which I have told you regarding viral fever. It is very important for us to understand that parents should know about the viral fever because a healthy child is likely to get 4 to 5 episodes of viral fever in a year.